So Trevor was telling me about your system here. So can you tell me a little bit more about it? It's
Yeah.
really important for us to know how we can get these and in a convenient way.
Yes.
And once we send a patient out to the lab, our attrition rate actually is pretty frustrating. And so this would
Yes.
be great if it was something that they could do at home or right there in the office with us.
Because it's very hard to go to the lab, drive there for an hour, and wait for an hour, and then come back with 10 bottles of blood. So
Yeah.
when we're building Generation Lab, it's a spin out from Harvard Medical School and UC Berkeley Comboy Lab, which is the longevity lab that we have been studied for more than 20 years. And now we have developed into this test, translating the science of Dr. Irina Comboy, who is the mother of longevity, and into a blood test that you guys can see in this simple test kit. And we'll be having a very easy in-home blood collection device, 5 minutes pain-free, needle-free. We'll be able to draw out the blood, and with the shipping inside, we'll be able to drop ship it to any USPS and picking it up, and you will get a report like this.
Okay, awesome.
It's a report that includes all of the 21 different systems that we test more than 460 markers to study preventive health rather than detecting
Reactive,
disease.
yeah.
Yes, and it's very important because any of the tests that people are currently doing, it's mainly focusing on disease detection. Do you have diabetes? That tests HbA1c, LDL, HDL for heart disease. But it's very important to test which part of your body is accelerating aging even before the disease is starting to show symptoms. So that's what we are testing with epigenetic to see how your genes are being expressed in your brain, muscle, liver, heart, reproductive system. And after this, it's important for us to tell them what are you gonna do based on the result, rather than just say, have a good day. So we'll tell them what is causing them aging, the top 5 aging factors right here. And according to that, we'll be able to tell them what is the best way for them to reverse their biological age, starting from medication related to longevity, supplements, any of the longevity treatments like peptide, stem cell. Specifically, if we recommend specific things for you, like coenzyme Q10, it's because your cardiovascular system is our top 1 aging factor. And you will do this test every 3 months or 6 months to track how fast you're aging and how much have you reversed your biological age. We have been seeing people within 3 months is able to purely using lifestyle change or supplement, able to be reversing 19 out of their 19 systems, all back to a younger place. Similarly, stem cell is better for your cellular regeneration and also for your brain age reversal for about 13.6 years old as a case study. Plasma exchange, TPE, is able to be reversing inflammation and also the specific immune age by about 6.5 years old. So that's a lot of case studies that we have been working with 750 clinics, over thousands of doctors are using this test as the golden marker of aging.
Right. So, 20 years ago, if you said epigenetics to anyone, they didn't even know what we were talking
Exactly.
about. And so having people have an understanding that our genes are just expressing
Yes.
and we can clean that up and actually help reduce that inflammation, which is the heart of our disease,
Yes.
it's really just quite fascinating.
And it's crazy because 80% of the disease are caused by aging acceleration, but no one is actually testing that. And it's us that has been studying extensively, and started from today, we have launched a new test, first time in the world separating male aging, female aging differently in different sex. Can you believe it?
I cannot.
No one have ever studied male versus female is aging very differently.
Okay.
Starting from our reproductive system, and that's impacting our immune system, impacting how the brain or bone is aging in different gender. So the curves of aging, if you curve it out, is actually very different between male and female. And before, we just see it as unisex, which biology is not unisex.
It's so simple, but it's actually very
Yes.
true, everything you said. Even though it's not something I was familiar with 30 seconds ago,
Yeah.
it just innately makes sense. So when our systems are aging, what do you see the biggest stressor? Is it oxidative age? Is it again those environmental factors?
Yeah.
Like what are you seeing like as a trend?
Yes, the trend that we're always seeing is inflammation, especially chronic inflammation, is driving your aging factors a lot faster than it's supposed to be. And inflammation could be caused by emotion, your lifestyle, your environment, your stress, and what you're drinking, what you're eating, microplastic. All of these things are contributing to chronic inflammation that's in your body. Basically, is your body is not able to heal yourself as fast as it's supposed to be. So the rejuvenation and the regeneration ability of your body has been slowing down. And we call that process as aging. And now it's fixable and it's reversible. So,
And what do you think the number one, so reducing inflammation, and again, we'll probably have to decide like what organ system that hit and what we're doing specifically, but could you help me understand from your data what we're seeing the most as far as the inflammation and what modalities or supplements that we would use?
yeah, for inflammation, if you see in the report, what we are seeing is not just your inflammation is high, which is we do test inflammation age, like which is the speed of aging in your inflammation regulation. But we'll tell you that hey, your aging is speeding up in your heart specifically. Then if that heart is your top aging factor, that's what's causing you aging the most, then everything that we recommend is going to come through PubMed and also clinical trial that we tell you, hey, instead of NAD+, use coenzyme Q10 because that is proven to be better for your heart. And most impressively, people have been finding this test is able to be detecting early signals before disease is happening. One of our customer, Jamie, she is a nurse, and she found out her aging in her heart is being accelerated a lot, like 10 years older than herself. She decided to do a CT scan, and what she found is there's nothing that's happening, but there's calcification that starts to aggregating, which will lead to heart disease if she doesn't recognize it. So we're getting calls every day saying, thank you very much for letting me understanding my body more. I thought I'm completely healthy, but now I realize aging is a stage that we can start to managing it rather than it's healthy versus disease, a very binary test.
So in this test, is there also a basic panel for hormones, or is it specifically just for the biomarkers in the organ system?
Great question. We only take a look at aging-related biomarkers. So hormones are being treated as more downstream that you can get through Quest Diagnostic or any other companies that's doing normal blood panel. But we have our own customized chips that designed by us and manufactured by Illumina that's collecting more than 250,000 data from you from top to bottom.
Okay.
Yes, but we haven't added hormone specifically, these type of normal blood tests in this.
Okay. And so I guess my last question then is, the clinician really would have to be able to marry some of those other downstream identifiers that we know and we've been testing for years to this data.
Totally.
And do you have a customer support center for that?
Yes, we have customer support center. We also have education centers specifically for clinicians who will teach you how to interpret these reports and also the science behind it. We're hosting weekly webinar to explain the science behind it, and we also have tons of clinical studies that prove whatever that you are currently prescribing, how exactly is it changing biological age. And you can also enroll into the trial to test whatever that you're currently doing in clinical trial or stem cell, anything, peptide that you're prescribing, how much did your user has been improved, which is a very key point because if you can't see it, then you can't prove it.
Very true. We need the data.
Yes, we need the data, and this is the way to go to solve your churn rate and at the same time increasing your revenue. Because after people see the test, what do they want to do?
And you said 4 times a year?
3 times to 4 times.
3 to 4 times a year.
Yeah.
Okay.
Depends on what you're doing. If it's more extensive treatments like stem cell or plasma exchange, then you can do it 4 times per year because you'll track changes very fast. But if it's supplement or lifestyle, as less as it's 3 months apart, we'll be able to see the changes.
Okay, that's fantastic. Thank you so much.
Of course. Thanks to everyone for listening.
All right.
Thank you.